have a lot of questions when it comes to the risks involved with COVID-19 and children with underlying health conditions. So we're speaking with a pediatric infectious disease specialist from her office about how parents can navigate the options that are best for their family. Dr. Barnett, what underlying health conditions can put a child at greater risk for COVID-19?
That's a great question. I think you may have heard of some of the underlying conditions that put adults at risk, and many of them are the same for children. Things like heart disease, lung disease, diabetes, and obesity. As far as allergies are concerned, that doesn't seem to be something that's come up as a major risk factor. Well-controlled asthma as well could be a minor increased risk, but if the asthma is well controlled, I think that is a child who could return to school. I would be a little bit concerned by the child who has quite severe asthma that is not under good control. And that would be the time to speak with your pediatrician about whether your child is ready to return to school at that time.
We're all hearing about multisystem inflammatory disease in children. What is that exactly, and what do parents need to know?
The good news is that it's extremely rare, we believe, in contrast to the number of infections with COVID that have been reported throughout the country. The major symptoms of that condition are fever and abdominal pain, but almost any system can be affected. In general, this is a rare condition that occurs about a month after a known COVID infection. And I think the main take-home message for parents is that any child who is ill during this period of time, you can contact your pediatrician and discuss whether the symptoms your child is having could possibly fit in the context of this syndrome.
Are there ways to minimize the risks of the spread of illness at school where parents work in the healthcare field?
So I think you would minimize those risks doing the same thing you do to minimize your risks in general. You and other adults in the child care facility will be wearing masks and keeping appropriate distances. Healthcare workers are as concerned as every other parent about bringing home COVID to their families, and I think are particularly meticulous about what they do to prevent disease in their own families. And in fact, in some settings, healthcare workers have lower rates of infection because of all the precautions they're taking. Children of healthcare workers should not pose any greater risk than any other child in your facility.
Thank you for the advice, Dr. Barnett. For Parenting Under 5, I'm Christina Nicholson. Thanks for watching.